My name's Claudia Schaff. I'm a bilingual speech-language pathologist. I work in Norman, and I work right now primarily with children, ages from 1 to 5. I used to be a teacher, a second grade teacher, working with bilingual children, and I noticed that the speech therapists that were available at the schools were only English speaking, and that there was a need for Spanish speaking bilingual speech language pathologists. So it piqued my interest. I knew I would have to go back for another master's, but it was well worth it. I think the strengths in this career are for me, it's flexibility. You can either work with children, you can work with adults, you can work with teenagers, or you can work part-time with children and part-time with adults. You have that flexibility. So you can work full-time, you can work part-time, you can travel. There's traveling speech language pathologists, just like there are traveling nurses. And it's just, you don't get bored. Well, first, most recently I was working in the hospital setting and where I am now at a Head Start. So a typical day would be going in to the Head Start where I've already evaluated and determined who my patients will be at that Head Start. And I will pull them out of their classrooms for 30-minute sessions. And I get to work with the children on their goals. Some of them are articulation goals, some of them are language goals, some of them are social goals. And then I return them back to their room. That's about 4 hours. In the afternoons, I would head over to the hospital where I would fill in as what we call PRN, as needed, to work at the rehab with adults, anywhere from patients with disabilities from stroke, traumatic brain injury, or we also, in our field, a lot of people don't know, we work with individuals who have difficulty swallowing. It's called dysphagia. And so, again, that's at the hospital. So your day can be going from working with little bitty children to 85-year-old patients. And so each day is different, and that's what's so much fun about this field. The school setting, you're going to be constantly interacting with the teachers, in addition, of course, with the parents as well, but the teachers, first and foremost, are going to be able to communicate with you as far as how is the child progressing, are they transferring those goals into the classroom setting? And of course, the principal or whoever the director is of that school, you'll communicate with them. In the hospital or rehab setting, you really rely on the physical therapist and the occupational therapist, in addition to the nursing staff, of course, and the doctors. But you work as a team. You relay what goals you've established for that patient, and you want to see, again, are those goals transitioning or are they transferring over into those other disciplines? And specifically, the doctors that you really want to communicate with the most in the hospital setting are going to be the radiologist, because when we work with patients with swallowing disorders, you're going to want to talk about the x-rays, the lungs in particular is what we look at to see if that patient is improving as far as their pneumonia status, which again relates back to the swallowing. So you really rely on a lot of people, and you get more information back from them to then change your goals as well. So again, everything from the little child who's working on their articulation goals to the patient who's recovering from a stroke. In the healthcare setting, I would say the occupational therapist, the physical therapist, the nurses, you've got to rely on the nurses. They're seeing the patient more than anybody, and they're seeing the patient communicating, they're seeing the patient eat, they're seeing the patient communicate with their families. And again, the doctors are wonderful support as well. So it's particularly in our field, in the last 10 years, I think people are really seeing the value of the speech-language pathologist and how we can collaborate with the patient and with the family so that the patient can achieve the goals and get back to communicating and to socializing and eating as well. Eating, it's funny, people don't think that what would we have to do with eating, but since that is within our scope of practice, I always tell people, eating is social, and when you can't eat and you can't swallow, you're going to miss out on a large part of your culture and your family scenarios. So I graduated with a journalism degree, and I did work in journalism for 2 years and then pursued a master's in education. And so as a teacher is where I was able to discover this field and learn more about how I could work one-on-one with children with language disabilities and articulation disabilities. But more than anything, to be able to help a child who couldn't communicate with their teachers or their family members in a more personal setting. Because you can do that as a teacher, but one-on-one, it's just so much more personal and I feel like rewarding. And when I was working as a second grade teacher, I had a student in the classroom. She spoke both English and Spanish, but she wouldn't speak in public. And the appropriate term for that is selective mutism. I had never heard of it. I had seen quiet children. I had quiet children in my classroom, but I didn't know there was a technical term to it. And she was being seen by the school language speech pathologist. They utilized me to translate a lot with her because they were concerned that it was a language issue. I provided them with her written work, and all of her work was written beautifully in English. So I knew it wasn't a language issue. It was a psychological barrier that she had with socializing in public. So just watching her develop and her journey really inspired me to further pursue this field, and knowing that I could help children who didn't speak speak English as their first language, that I could be that bridge for them as a Spanish speaker. Most importantly, I would encourage Spanish speakers to pursue a career in the allied career field. Specifically, in my experience with being Spanish speaker, there are not many bilingual speech-language pathologists in this area where we are right now. And it's important because there are children who may have a language disability or disorder, and it's not necessarily because they don't speak English. They have that disorder in their own native language, Spanish. So being able to distinguish that, whether it's a language difference between a language disorder, you have to be fluent in both languages. So I get calls from lots of friends from grad school who are now out working in their schools or in a hospital setting, and they will reach out to me and provide examples of their patient, and they need to know, is it because the person doesn't have command of English, or is it because there is a true disability or disorder in their native language? So I really would like to encourage young Spanish speakers to pursue a career in the allied health career field so that they can be that bridge for this community that really needs them. Something I would like to share to students is that there are not just positions available for doctors and nurses. When I was working at OU, I remember talking to a lot of young freshmen who thought that when they thought of medicine, they only thought about pursuing to be a doctor or to be a nurse. And the allied health field is so varied. I would encourage students to look into, whether it be a radiation tech or an occupational therapist, a physical therapist, pharmacy tech, or pharmaceuticals, or speech-language pathology. I would encourage them to explore the other allied healthcare fields, because it's not just doctor and nursing out there. However, we need more nurses. I just would encourage them to, there's so much available within the hospital setting and within the rehab setting. It's just, I mean, there's a lot more out there than what they think there is. So I would encourage them to do that.